So the mobile web is a little more limited in terms of what it can do on your mobile device. So you have much more hardware integration with apps than you do with the web. Like for example, you can really easily get to the camera. You can easily get to Twitter on the iPhone. You can use the GPS in an app, and it's much better integrated. And an app can also work when you're not online because you can already cache some of that data, whereas mobile web, you can't really do that. So the first and foremost thing is you want to think about who your user is, who's going to be using this app, and what are they going to be using it for. What is your intended goal for them using this app? So that's the first thing. The second thing to really look at is how do you make the design of the app so that it's easy for someone to use it, so they don't have to think about, okay, what am I doing here? How do I do this? Which button do I press? You want to make it as easy as possible, as clear as possible, and be aware of the current trends in apps and in design, so that you're not having to teach your user a new way of using an application that they're not used to. So right now in Silicon Valley, people are really trying to figure out what the monetization models are for mobile health apps. You know, are you going to make the user pay? Is it going to be insurance, or is it going to be an employer? Who will actually pay for the development and the upkeep of an application? Because oftentimes when you have an app, you can't just leave it. It's software. You have to kind of make sure that it gets supported. You know, so in our own experience, we've often had this where when you get a new device or a new OS update, something will break in the app. So then you have to go back and fix the app so that it'll work on the new system. So AppsOnHealth has been great so far. I've only been here for the morning, but it's been a good mix of speaking to clinicians, hospital administrators, and app developers. So that's a great cross section, and I love Barcelona. So as a city, it's a great city.
So this is a model that's been growing in popularity in recent years in the tech industry, where there are these kind of 3-month boot camp programs for getting consumer tech businesses to market and to get funding. Our sense in kind of working in the healthcare space is that healthcare poses some unique challenges for entrepreneurs as far as accessing the right people and the long sales cycles in healthcare and the kind of unique payment dynamics. So we felt that there was a need to tailor that type of program to healthcare entrepreneurs. So the program that we're running right now, which is called Healthbox, is a 3-month program. We selected 10 teams to participate. They get $50,000 in seed capital in exchange for equity, access to a mentor network and strategic partners that can help them kind of iterate their products and find potential customers. And then the program culminates with a demo day in which they're able to pitch to investors to raise funding. 3 that I'm aware of, there's one in San Francisco called Rock Health, and one in New York called Blueprint Health, and Healthbox is in Chicago. Sure, so that is kind of remains to be seen. I think it's only been in the last couple of years that we've seen a lot of physicians and other stakeholders take up these mobile health apps, and as I think Chia mentioned earlier, the opportunities for monetization are still a little bit unclear. Our sense is that regardless of whether an app is consumer facing or industry facing, I think in most cases, for something to become a big business, you're going to need to find either a health plan or a health system or some sort of large industry stakeholder that finds value in that app and is willing to pay for it. And by value, I mean right now mostly things that can either reduce cost or improve efficiency, or improve outcomes in some way. Yeah, I mean, I think some of the most interesting ones right now are some of the patient tracking apps that allow for passive information collecting. Data entry is a big barrier to uptake for consumers. So some of these new technologies that either sync with peripheral devices or use the actual phone or tablet itself that can kind of collect information in a continuous way, I think will hold a lot of promise. I think the next step, though, beyond information collection is really figuring out how to use that data to improve outcomes and improve the system. And I think there remains a lot of opportunity in that area. It's great. I just got in last night, but I've spoken with Jorge and some others around some of the really innovative things that they're doing at this hospital and others. It's really exciting to see innovative solutions that are kind of being brought to market in other places. So I'm excited to be here.